Chapter 8. Building a Case File. When working with clients, case managers build case files that include information related to the agency's goals and the individual client's needs. A case file often includes medical, psychological, social, educational, and vocational information. Accurate and up-to-date medical information is a crucial part of the case file, especially for clients with medical issues or disabilities. Sometimes this information helps determine eligibility for services and determines the client's functional limitations or potential for rehabilitation. Because of this, the case manager needs to be familiar with medical terminology, conditions, treatments, and limitations in order to understand a case. Medical information may be presented on a form or written report. Agencies will differ in their approaches to medical information. Medical evaluations can include recommendations about the individual's physical, emotional, and intellectual capacities. Clients must be prepared for the experience of a medical exam so they'll know what to expect. This is particularly important from the multicultural perspective. A medical evaluation may be used for the purpose of a medical diagnosis, which gives a general health status appraisal of an individual. It determines whether a physical or mental impairment may be present. Some of the diagnostic medical services available include general medical exams, psychiatric evaluations, dental exams, exams by medical specialists, and lab tests. A diagnosis can provide important information about social and psychological aspects of a case in addition to medical aspects. A medical consultation is communication with a medical professional who can interpret medical data, determine implications of that data with regard to health and employment, and recommend additional medical care. In order to be of help to clients, the case manager must understand medical terminology, how the skills of specialists relate to diagnostics and treatment, and the effects of disability on a client. The medical service most often used in human services is the physical examination. A physical examination provides information about a client's medical history and states findings. A diagnosis involves obtaining a complete medical history and conducting a comprehensive physical exam. When referring clients for medical evaluations, case managers should explain why the referral is necessary, the amount of time the exam will take, what outcome is expected, and how the information will be used. We've mentioned a couple of times already that it's important for case managers to understand medical terminology, so we'll discuss that in more depth now. Medical terminology is the technical words and phrases that are used by physicians and other health professionals. It's important for case managers to have a working knowledge of medical terminology so they can understand medical reports. To understand the basics of medical terminology, consider the following 4 elements. First, the word root, which is the main part or word stem. Second, the combining form, which is the word root plus a vowel. It's often O. Third, the suffix, which is the ending of the word. And last, the prefix, which is the word element at the beginning of a word. To work out the meaning of a medical term, identify the suffix and its meaning, find the prefix if there is one, determine what it means, and then identify the root words and their meanings. This table provides a list of common prefixes and suffixes in medical terminology. The text provides this table in Chapter 8 as well. Staying current with medical terminology can be challenging for case managers. The changing course of medical knowledge in combination with ambiguities and inconsistencies create these challenges. Case managers can keep themselves informed by staying current with trends in medicine. They also can keep themselves aware of chemicals, syndromes, and diseases that are newly named and may be given acronyms or abbreviations. Case managers also have to remember that words may have multiple meanings. In addition, several names may apply to a single health issue. Psychological reports are important documents in the client's case file. The objectives of a psychological evaluation are to contribute to the understanding of the individual client and to provide justification for particular services. Psychological reports may establish a diagnosis to meet eligibility for services. They provide information about a client's personality, aptitude, interests, intelligence, and achievement. They also may resolve contradictions or ambiguities and information that's missing. Just as with medical evaluation, case managers should also be familiar with language and terminology used in psychological evaluations. Case managers also should prepare the client for a psychological evaluation. This helps ensure a successful referral. A psychological evaluation involves a study of past behavior, conclusions drawn from observations of current behavior, a diagnosis, and recommendations. The psychologist acts as a consultant to decide what kinds of data must be gathered to carry out the assignment required by the referral source, which findings have relevance, and how these findings can be presented effectively. A psychological report is a written document that explains an individual's personal characteristics, mental status, and social history. It provides information that helps to determine the problems and challenges facing the client, as well as possible interventions. A psychological report may take several different forms. The most common form is a narrative. Components of the report include orienting data, which is the reason for the referral and pertinent background information, illustrative and analytical content, which is the interpretation of raw data, and conclusions, which are diagnoses and recommendations. Sources of information for a psychological report are the interview between the psychologist and the client, test data, behavior observed during the evaluation, any available medical reports and social histories, and any observations, case notes, or summaries written by other professionals who are involved with the client. A psychological diagnosis is determined through the use of the DSM-4-TR, which is a manual that provides a way of classifying mental disorders. A social history is another important piece of information that helps to complete the client's case. In a social history, the case manager learns about the client's past history and present situation to understand the client's problem-solving strategies, his or her developmental stages, and the nature of interpersonal relationships. Taking a social history also helps build the relationship between the client and the case manager. It helps bridge gaps in information, may provide a better assessment of the client's needs, and may fulfill legal requirements. Social histories do have some limitations. They may lead to premature categorizations and judgments. Also, excessive questioning by the case manager may lead to a dependent role for the client. In some instances, a social history may give an inaccurate view of what will happen, and some clients may misunderstand the social history as therapy. The social history does present an opportunity to continue building the relationship with the client. They are always taken within the cultural context of the client, so clients are treated with cultural sensitivity. A social history likely will include the following 9 areas: identifying information, the presenting problem, the referral, medical history, personal and family history, education, work history, economic situation, and personality information. The client is generally the primary source for the social history, but other sources also may contribute information. Depending on the type of services the agency provides and the needs of the client, other types of information may also be included in the client's case file. Educational information such as test scores, classroom behavior, relationships with peers and authority figures, grades, suspensions, and attendance records may be relevant in some cases. Indications of academic progress, such as repeated grades and advanced work, also may be relevant. For many clients, vocational information such as employment history, relationships with coworkers, and work habits may be helpful depending on the needs of the client and the services he or she will receive. This information helps to round out the case manager's understanding of who the client is, strengths, weaknesses, abilities, and aptitudes.